Oy.
What kind of workout did you
I
do?
ran for a little over 5 miles.
Oh, good.
In the house or outside?
Outside.
Outside?
That's allowed. They said outdoors workout. And I live in Monterey Park. There's no one out here.
Yeah, but did you leave your shoes outside?
Gosh. No.
You
Listen,
should.
by this time, I didn't know about that. Listen, that's why I'm chiming in.
So you should leave your shoes outside next time, though.
Okay, no, we'll do. We'll do, seriously.
Mm-hmm.
Hello, everyone. Good afternoon.
Hello.
Oh.
Thank you for joining. And hello, doctor. Thank you for your time. And thank you, Queen Vanessa, for your assistance today. And let's see. Who do we have? Let's check in.
Hi, Latrice, I'm here. I just have a towel on my head. I'm doing a deep condition, so I thought I could just explain my name.
Okay. I know that we have other people that wanted to attend, so let's just give them a few minutes, but we can continue to check in while we wait for others.
Are we gonna go live on Facebook so folks can join too?
Yes, I was just gonna wait until we
Gotcha.
got a few more. I know 3 o'clock is really early, and people are like, well, no, 3 is good. We don't have anything to do. But last night we did 7 p.m. and it was pretty active. So I guess maybe that was the time everyone was officially lounging.
Not me. I was asleep.
Of course.
You know I'll be
an early bird.
You know I'll be knocked out.
I'm like, gosh, what is wrong with this guy?
Wait, I think I'm on the wrong meeting. What is this meeting about?
Oh, well, what do you think it's about?
Well, because I was supposed to do with APLA. That was supposed to be the meeting I'm on.
Oh, darn. Well,
It's about
particular
COVID.
chat. Well, this is a chat about COVID, or it will be.
I'll join you nevertheless, but I just don't know if they'll miss me. But anyhow, yeah, go ahead. I'm sorry, I didn't know. I just got it in my email and assumed it's the same time and the same topic. So I assumed. I don't know how I got this email though.
Well, it might be a blessing. Introduce yourself.
Oh, well, I'm Cyrac, and I actually work, by profession, I work in the entertainment industry.
Okay.
But I actually could share stuff with you with regard to COVID too. So I guess I'm on the right track.
Well, see, that's the universe. It worked for us. Thank you.
Are we going to
God
do
works in
pronouns?
mysterious ways.
Thank you. And your name is Chirac?
No, it's Cyrac. It's Sirach.
Cyrac. Thank
Sorry.
you. And what are your pronouns, Cyrac?
He.
He. Thank you so much. And
Thank you.
hello, James. Welcome.
Hello.
How are you?
I'm
Want to introduce
I'm
yourself?
not COVID-19. My name is James Wen. My pronouns are he, him, and his. And I'm happy to be here.
Thank you for joining. It's been a long time since I've seen you. Thank you. And we have Chris. Are you hot?
Oh yeah, I'm sorry. Cyrac was just telling me a few good things. Next time I go for a run, to leave my shoes outdoors. So he definitely has already contributed. But yes, I just came back from a little over 5 mile run. So, but I'll be.
Okay, so you're cooling off right now.
Yeah.
Good thing we can't smell him.
Oh. See,
Listen.
comedy already. I love it.
I know.
Doctor, would you like to check in? We can't hear you. No. So I'm gonna go ahead.
Hello.
Hi, hi, Queen. How are you?
Good. Sorry, I'm a couple minutes late.
No, you're okay. Thank you for your time. So I guess the doctor's gonna hang up and call back in. So I'm gonna go ahead and move us over to that place, the book.
Oh.
Nina, you want to test it out? So if you go to the area where the microphone is, the lower left. Oh, I wish I could read lips. I can only read lips if you're cursing.
I am not on mute.
Oh, we can hear you now.
We can hear you now.
Oh,
Dr.
really?
Nina.
Well, I wasn't on mute, but then I toggled it and I went, people can hear me. So my name is Dr. Nina Harawa. I'm a professor at the UCLA School of Medicine and at Charles Drew University of Medicine and Science. My background is in epidemiology, so I'm a PhD, not an MD, but I'm here at partly at the request for the invitation of Ms. Chela to talk about COVID-19 as well. And my pronouns are she, her, and hers.
Thank you. Thank you so much for putting some time together to be here to answer our questions. So many people have questions that they want answered. Vanessa, were you able to check your email? Oh, wait.
Yeah.
Okay. So hold on, everyone. I am transferring us to Facebook. So I just want to give a disclaimer. I mean, of course, we're all at home, so mute your, if you're not talking, please mute your, go on mute. And if you are talking and you happen to have Grand Theft Auto background sounds, we'll just let you keep talking and pretend we don't hear that. Okay. Okay. So we are now live on Facebook. So thank you again for everyone joining us. And for those of you that are joining us streaming, if you want to dial in, you could dial 669-900-6833. Again, if you want to dial in, that number is 669-900-6833. So today's tribe chat is really all about COVID-19, getting to the truth of it, and also dispelling some of the myths. But before we actually have our guest, Dr. Nina Harara, join us for the conversation, I just wanted to, sometimes we don't really understand the severity of certain things because maybe we feel like it doesn't relate to us, or somehow the messaging, the news, it doesn't resonate with us, right? So I figured if I started off today's chat with a little bit of course, we're a Los Angeles-based chat, so I just wanted to give some of our local city infection rates, just so I can bring it home, so we can see exactly, what's happening in our very own neighborhood. So let's see. So in Los Angeles County alone, there are over 3,000, or there is exactly 3,011 cases. This was as of last night, and there were 54 deaths in total. So I want to break it down just so I can bring it to your neighborhood. So Adams and Normandy, if you're familiar with that area, there have been 5 reported cases. Mid-City area, 11. The Melrose area, 100. North Hollywood, 39. Silver Lake, 20. Van Nuys, 13. Watts, 7. West Adams, 12. West Hollywood, 56. West LA, 20. And Compton, 16. Oh wait, hold on, 2 more. Long Beach, 133 cases. That's Long Beach by itself. Riverside County, 371 cases. And 13 deaths come from Riverside just by itself. So if that doesn't bring it back to where it is in your own neighborhood, in your own backyard, like that's real stuff. That's like right outside your door. So it's when people say, well, it hasn't hit home yet. Well, it has hit home. It's here. So, I mean, what do people think about that? I mean, does that make it any more real for you?
Hi, everybody, this is James. I definitely think it makes it very real, but more importantly, keeping safer at home in mind, keeping the social distance 6 feet apart, and washing our hands. I think those are very important action steps that we can take to protect ourselves and each other, and also then continuing to connect with each other on Zoom or on the phone. I'm excited to share tomorrow on a sort of a Zoom conference with my father, who's in Virginia, and I've joined up with my 2 sisters, and that connection within our own community or our family of origin, our friends, to please continue to do those things to stay buoyant.
Thank you, James.
Can I talk?
Yes, Sarah.
Right. I'm Cyrac. I'm an accountant by profession, but I'll share my thoughts on COVID. And after I share my thoughts, you guys can ask questions or do your own analysis. But I would actually sum up COVID, the way to solve COVID into five steps. First is protection. COVID, the entry points of the virus are 3 entry points: the eyes, nose, and the mouth.
Okay.
And so first you have to do is protect yourself from those 3 entry points, which is the eyes, the nose, and the mouth, right? So now let's just say, I'll give you a scenario. You've protected yourself. You have eyeglasses, you have mask or a scarf or whatever you can cover your mouth and nose with. So you're protected, you're safe, right? Next is actually protocol. Protocol in the sense that you protected your eyes, your nose, and your mouth, but it's now safe to assume that the outside world is totally contaminated, right? Because per the CDC, the virus can live for 17 days. That's based on I don't know what the current number now, 3 days? Yeah, but that's three days because that's based on what they have right now, right?
So I'm talking about on surfaces, on most surfaces like plastic and metal, 3 days, cardboard a day, 24 hours. Are you talking about inside of somebody or depends on
No,
what
because I read an article for the CDC on that cruise ship. It lived for 17 days on a cruise ship, Diamond Princess. It lived for 17 days.
I'm
So-
familiar with the article or the cruise ship, but the best evidence is that on surfaces, it's
Well, irregardless of how long it is, if you calculate basic math on the spread of the virus, it is still fully contaminated world. If you assume, because with the speed, let's just say, with the speed of free infection, right? We are now at 3,000, correct? Currently in Los Angeles alone, right? Okay, if those 3,000 were left untreated, and the virus lifespan is 14 days, by the 14th day, it would have hit about more than 14 billion, I think, if my math is right. So if you leave those people untreated, these people, but let me continue, regardless of how long it is. Let's just say, okay, if 3 days, the virus lives 3 days in the outside world, but movement makes the virus spread, right? That's why they always say lesser spread, lesser movement, lesser spread. So my next point is protocol, because we can do social distancing, as what they always say, 6 feet apart, because that prevents you from getting the virus. Yeah, I agree, it does. But it doesn't end there, because I could be asymptomatic and carrying the virus, because people can be asymptomatic for 14 days and not know that they have the virus. There's studies that shows that, because some people can fight the virus naturally. So they can be asymptomatic for 14 days and walking around. Like, for example, simple example of, I'm asymptomatic, I'm walking, I'm singing, guys. I'm a happy person. I go singing while walking, and you sing without even an intention, even just mere talking. You can have your saliva go out, right? Like, it will get out of your mouth, right? So here I am singing. Oh yeah, I'm so happy. Yeah. And so the saliva went to the ground, correct? Or to the railings, or anywhere that your saliva could possibly drop, right? So next is, myself and the person next to me is doing social distancing, 6 feet apart, correct? But the person next to me is healthy, doesn't have COVID. I have COVID, I'm asymptomatic. I wasn't wearing masks, I wasn't, because I don't know that I have COVID. The person next to me passes by the area I passed by. So the person next to me who is actually healthy could have it in the person's shoes, and then if the person that touched the railings, in their hands. So now that person next to me, that's why lesser movement, lesser spread, is now carrying the virus too. And wherever that person goes, there's a possibility that the virus is spreading, correct? So next is that, okay, that person who is healthy goes home, right? So I'm healthy, I go home. I didn't know I'm carrying the virus, but I'm protecting myself. I have my sunglasses, I have my mask or a scarf to protect my mouth. So I'm protected, even if my hands have the virus, my feet have the virus. I wash my hands when I go home, because that's what they always say, wash your hands for at least 20 seconds. So I wash my hands, because I was, we became OCD now, obsessive COVID disorder. Which is like, oh my God, I have to wash my hands before I touch my face. Oh, no, I can't do that. So now you do that. So, great. That person was like, I got this. I'm gonna wash my hands before I touch my sunglasses, my eyeglasses, or my mask. So I got the eyeglasses down. I got the face mask, the mask down. I'm safe, right? My hands doesn't have the virus. Everything that I touch don't have the virus. but I forgot to leave my shoes outside. I walk around the house because I was like, oh, I'm good. The virus is now in your house. It's all over your house. That's how I see it. Next, another way, because we always make mistakes. That's why you have to protect your eyes, nose, and mouth at all times, because we are humans. We'll never be able to always, because that's not our human nature to like, oh, wash my hands before I touch my face, or so you protect those things first. So you already have protection, protocol, and my next thing is nutrition. So your body can naturally fight the virus, right? It's a God-given gift. You can naturally fight the virus if you have the essential elements that can boost your immune system. Which is vitamin C, vitamin D, zinc, magnesium, and selenium. So those are the key elements to naturally boost your immune system, that should you happen to get the virus, you have that natural ability to fight the virus naturally in your body. Not like, fight the virus naturally. But for those people that are in the hospitals, of course, you still have to address the pre-existing conditions. Like, fight them, give them those natural elements to naturally fight the virus, but at the same time, you also have to address the pre-existing conditions. If they need a ventilator, give them a ventilator. If they have fever, address the fever. If they have diarrhea, address the diarrhea. But at the same time, it has to be congruent to making the body naturally be able to fight the virus. Because you are helping that
Thank
person
you for that.
naturally fight it.
I just want to jump in a moment so that we can check in with our co-facilitator, Queen Vanessa. But thank you, Sarek. That's very valuable details. And we'll check in with the doctor just to make sure that we could fact check that, okay? So Queen Vanessa, go ahead.
Yeah, thank you so much for sharing that. I'm really happy to have this discussion. And I think listening to what was shared, that made me definitely want to engage in dialogue with our doctor, especially given how many people could be joining us and have a lot of questions that they would love to hear elaborated upon from our doctor that we have. So it'd be really cool if we could, just get a chance to listen to someone who, has some facts that could elaborate a little bit and, just dispel some of the myths. I think, one of the biggest struggles that I know that I face and that a lot of people that I've spoken to face is just being overwhelmed by the amount of content that we're receiving from multiple sources about how this is spread and how this is treated, sort of the different precautions that we need to take in order to avoid becoming infected with COVID-19. And so I think it's really important that we hear from, someone who is wants to learn especially around like the origins and where it came from and how you get it. So I guess, Dr. my question for you.
Is that her reception or
just
mine?
Starting at the very beginning, what
Queen, I'm sorry,
and,
Queen Vanessa.
What does it do?
We do need more volume. You're coming across really low.
I think I was able to hear your questions, but yeah, it's a little bit, it'd be great if you were clearer.
Oh, so Nina,
It's like her reception, bad connection.
I think so.
Okay, so if Dr. Nina, if you were able to pick up pieces from Vanessa's question, okay, please?
Yeah, I can start to address, and then hopefully, Vanessa, we can get the connection a little bit better, and you can ask me some additional questions. So, I certainly hear the point and the concern in everyone's, my guess is that a lot of people have that we know we're dealing with something very, very serious. There's a lot of information coming at us. It's a little bit hard to know what all is true, but also what are the most important things, because we can't control everything, right? And so I think it's really important that we do focus on the things that are most important to do, and then do as many of those other things, but really focus on what's within our control, because sometimes it can be a little bit challenging to create, like, for example, a completely sterile environment in your home. I have trouble just keeping my home clean with 3 or 4 of us here, much less sterile. So I wanted to talk about a few different points. I think one of the points that Cyrak was making, which is an important one, but also one we have to add some caution to, is this idea of having gear that will protect the entry point. So it's very true that those are 3 entry points, but being able to protect them easily is not as simple necessarily as having a mask and a scarf or eyeglasses. Because what happens with any of those things is that, for example, we might have a scarf, we might pull it up this way, later we take it down, now we pull it up another way. We've now taken everything that was contaminated at one point and put it right next to our face. So it can be tricky how to best do those things. Glasses probably have some prevention, but they're not goggles, right? So they're not necessarily going to stop everything from coming in. So I think all of those things are good to consider, but I don't want us to think that we're protected if we just do those things. It's sort of like the concept of safer sex with HIV, although it may be even less protection than, say, typical condoms or other kinds of barrier protection might provide. But those 3 things of reducing the likelihood that anything goes into those points, keeping our hands clean, and keeping the social distancing are really key. And I wanted to say a little bit more about why the social distancing is important. When any kind of respiratory droplets or infections, most of the time when we're talking, there will be some bright stuff that comes out of our mouth. Most of that drops within about 3 feet. You sneeze or you cough, it's more about 6 feet. So and then everything, at that point, it's not really going to go any further. And so if we can keep that amount of distance from people, we really reduce our likelihood of coming into contact with the virus while it's in the air, or while it's in an aerosolized form. So that's one of the other key things of keeping the distance as much as possible, and why that can be so effective. There's different types of viruses. I just want to make a quick side note to, like, measles. Like, people don't always realize, for example, that measles is a respiratory virus, but it's much more infective and it's airborne, so it can go way, way, way further. But COVID is very similar to the flu in the way that it's transmitted and the way that you prevent it. The main difference, though, from the flu in terms of infecting other people is that you get symptoms, that you can transmit before you have symptoms, and sometimes even without having symptoms. And so now the latest information from CDC is that maybe 1 in 5 or 1 in 4 people with COVID, at least who have COVID in any given time, don't have symptoms. Either they haven't developed them yet, or in a small number of cases, they may never develop them. And the virus will go through, they're not going to always have the infection, but they may never develop them, and that virus, they can then pass it.
Doctor, I have a question for you. This is Latrice. So after somebody does cough, sneeze, 6 feet away from you, how long does it stay active in the air before it hits the ground, or what happens to it, like in transition, while it's airborne?
That is a good question, and I don't know that I have the best data on that. There have been some studies in which they've tried to simulate it, but it's a kind of a different scenario. So, I might have to get back to you. I don't want to tell you anything I don't know for sure, but I think the thought is it doesn't stay there very long.
Right.
And But exactly how long or, what estimates we have of how long, I don't know.
Okay, thanks.
But Vanessa, are you still? Oh, but there, I think you were about to start with one particular question, so I wanted to go back to maybe where you wanted to start.
Yeah, can you hear me now? First of all,
Yeah.
do I sound better? A lot better? Okay, great.
Yes.
Sorry about that, y'all. So I mean, yeah, the question that I had, I just maybe wanted to start with some basics and move from like a simple to complex, and just defining like what COVID is. I think you heard a lot of that, and you started answering a lot, like what COVID is, what are its symptoms. I think you also talked a little bit about how you can have symptoms and not show them. So, what is the range before someone determines whether they are, potentially carrying or infected with this virus, as a start, just to start. And you answered a lot of that already.
So starting with what COVID is, it's a part of a family of viruses called coronaviruses, and it's called a coronavirus because it has the proteins that are on the surface of it sort of look like a corona that you might see around the sun, or some people also think of it a little bit like a crown. There's other types of coronaviruses that we've seen epidemics of before, including SARS and MERS, the Middle Eastern respiratory virus. But it's just one as part of that family. Where it came from, or where all the evidence points to that it came from, was this animal called a pangolin in China that it probably first started in bats, then went to the pangolins, which are an intermediate animal, and that those were butchered for food in part of China, where it started in Wuhan, China, and then it eventually got into the human population. Those types of infections are actually fairly common. It's called a zoonotic infection, meaning it goes from an animal to a human species. And some of those other coronaviruses that I talked about are similar in that they're also zoonotic infections. HIV was a similar thing in that it started within chimpanzees and eventually went to humans. So really what we've been seeing over the last century, and probably centuries before that, but we've been more aware of it over the last century, is that this is how emerging viruses or emerging diseases come into human populations. And in certain parts of the world where you have more of that contact between humans and these various types of animals or wildlife, you're more likely to see that emerge. It's called COVID-19 coronavirus. I forget right now what the ID stands for, but the 19 stands for 2019, which is just when it was first came about. Next, I think I might have forgotten one of your questions. Oh, main symptoms.
Yeah.
So, there's a host of symptoms, but the three most common are cough, shortness of breath, and fever. Probably the cough and fever are the most common of those. The one where you should be really concerned or think about going to an emergency room or calling 911 would be the shortness of breath or the respiratory distress. Chances are, if you have other symptoms and can take care of yourself at home, it actually is probably better if you stay home, call your doctor, get their advice. But it's quite possible you don't have COVID, you'll go into a setting where there's a lot of COVID, or you'll get there and they'll tell you they can't really do very much because they're taking care of the people who are more critically ill with COVID. And so that's where it's important to think about, can I take care of myself? What kind of support can I get from my community if my symptoms get worse? What plan can I put in place if I do need to go somewhere and see someone? There's a couple, there are other symptoms. One of the interesting ones that I think is worth pointing out because it's so specific is that some people early on get a loss of taste and smell. And it's unclear how common that is, but I think it's a worthwhile one to point out because that's unusual. We don't get that with the cold. We don't get that with food poisoning, or maybe food poisoning. We don't get it with a flu, a typical flu. So I think it's something good for people to pay attention to if it does occur.
Can I
Hi,
ask a
Dr.
question?
Nina.
Oh, sorry.
Hi, Dr. Nina. My name is Shannon. I had a question. Now, you touched a little bit about the protection gear, the glasses, the mask, and the gloves. they're now advising us that if we don't have access to masks, we can start wearing scarves. Now, using a scarf, wouldn't that play a large part in cross-contamination? Because somebody like me, I would think using the same scarf over and over again is fine.
So I think so we have to think about it like this in two ways. When we're using like that kind of a, whether it's a mask or a scarf or anything like that, we're both potentially protecting ourselves, but we're also protecting other people. So if we're sick and we're protecting other people, when to reduce the likelihood that we're going to transmit to somebody else, then a scarf or even potentially reusing a scarf might be fine. But if you're worried about getting something from somebody else and you're going out where potentially the virus or, aerosolized particles are landing on that scarf, then my concern is it'd be very easy to then use the other side of it or use it in the wrong way, where now you're getting that stuff directly to those ports of entry that Cyrek was talking about, where you can get infected and get sick. So the suggestion more and more is actually that people wear homemade masks. And if you go online, there's different websites about how to make them. My guess is there will be an industry of people selling them. I think if anybody on this chat has skills in how to sell them, I'd actually consider, you might want to consider doing them and selling them. One of the good things about a mask is you can have it a different color on one side, so you always know what's the part that's supposed to go to your face and what's not. You can get multiple ones and then wash them after you go out. I will tell you, just on a personal note, yesterday my daughter and I went to Target. I have to tell you, it almost felt like a field trip, because after stuff inside, like just getting out was nice. And I could see that this advice was changing around masks, because before CDC kept telling people not to use them. And so I decided we were going to wear our masks, and we had those, like, she had a surgical one. I had one of those that are more like this, but the, kind of medical ones. They were so uncomfortable. There's a few problems with masks too, so I think people will have to get used to wearing them. They're very uncomfortable. They get hot on the inside. They make you want to adjust and do all this stuff. And so I'm actually looking forward to getting a cloth one that fits a little bit better, is a little bit more comfortable, because I can see myself using that correctly at one point. And I realized at some point, even though I was aware of all this, at some point I kind of moved it and scratched my nose, and I was like, what the hell did I just do?
Excuse me, can I speak? For those people who don't have masks, we are actually giving away free masks. We'll ship it to you. So,
oh, awesome.
So whoever wants mask, we'll ship it to you. We're giving it for free. So you can either text me, email me, and we'll ship it.
Maybe you could put it in the chat.
Yes, Cyrek, that's a perfect idea. Thank you. Can you type it in the? Can you type it in the chat section?
Sure.
That is amazing. Then that way everyone could copy it from there.
Disseminate it. Yeah, that's a really great idea. Thank you.
Thank you, Cyrek.
Or you can go to my Facebook page too. My Facebook page. That's my handle, and you can private message me, because I don't want your addresses and your names in my Facebook wall. So please private message me or email me or text me. Don't put it out in the world to see, please. But it's free. We ship it to you. You don't have to pick it up. And the more you order and you can give to your neighbors, friends, and family, I prefer that. So that's all I'm saying.
Thank you so much.
It's cloth. It's cloth and reusable. And it has filter inserts. So you can use coffee filters, tissue, whatever you want to put in that inserts. It's up to you. But nurses are using it. So that's all I'm saying.
Oh, Cyrek, if I could just ask, we run an organization right here in Los Angeles. So is it possible that you can maybe send our organization a bulk?
Yeah, sure. I prefer it in bulk, actually. The more you can distribute it, the better for me, because it's easier rather than giving it to one by one per person. So, because it's lesser movement, lesser spread. So the more you can distribute it faster and in a more efficient way, I would prefer that.
So actually, artwork could take that responsibility just so that you're not sending out individual masks. So Latrice, can you make sure you get his details so we can?
Absolutely.
Yes,
Thank
absolutely.
you. Go ahead, Vanessa. Thanks.
Yeah. Dr. Harawa, had you finished your thought before I asked you another question?
Well, I did want to add something. It's a different topic. So why don't you go ahead and ask your question, Latrice?
So you were speaking a little bit about the main symptoms that are noticeable out there, and I know, and again, like this is probably also through other content that I've consumed. There is some similarities between people who experience like PTSD and anxiety, and some similar symptoms of like tight chest. And how is there any other way to differentiate, like between like someone who is currently dealing with like anxiety or PTSD, and they're feeling like they're having a panic attack and it's manifesting as like a tightness in the chest, or it's manifesting in these COVID-like ways? Is there any tips or pointers or anything that you can say about that?
That's a great question. So like she was asking, I think you started breaking up again, but what I understood was you were asking if somebody has anxiety or PTSD and they have these symptoms like shortness of breath, tightness in their chest, is there a way to distinguish? So fever is not a universal symptom, but it seems to affect at least 80% of people, and that's not something you're going to have with anxiety associated with shortness of breath. But somebody could check their temperature. I think that's one way that they could distinguish. I actually don't know of other things. I'm curious if there's anybody that's on the call who has thoughts about this, because I think a lot of times people who deal with that, they learn how to manage. Chris, you were innocent to say something?
Yeah, actually, because the other day I was going for a run, and I have PTSD and anxiety, and I swore I had it. But the good thing about it is just doing that checklist that you learn. Like, I took my temperature. I have my little thermometer right here, and I just kind of like counted backwards, and I took a shower, and I just I said, if I have it, I have it. There's nothing I can do about it first. And I wasn't showing any crazy symptoms. So I guess just calming myself down really helped. So one thing, if you do have it, you have it. And in a sense, I know that's crazy, but in a way that can calm you down. And you have to start looking for a solution. But 9 times out of 10, if you do battle with PTSD or anxiety, a lot of the time it is just your anxiety. That's, acting up. That was it.
The other thing I was going to say earlier in terms of a really important other thing to take care of yourself in a way to reduce the likelihood of, it may not prevent you from getting it, but at least from having a serious outcome from COVID, is to take care of those other conditions that you might have. If somebody's living with HIV, if they have hypertension, if they have diabetes, doing everything you can to keep those things under control is really key. So it's not necessarily about, do you have hypertension or not? It's, do you have uncontrolled hypertension? So if you need, a lot of times people don't like to take their blood pressure medication, but this may be that extra motivation at this time. Same thing with HIV. It's really about what the T-cell level is, not whether or not they have HIV. So the best data seems to indicate that if you have above 350 T-cells, you're no more risk. COVID is very similar to the flu in the way that it's transmitted in the way that same thing with HIV. It's really about what the T-cell level is.
Who's not muted?
Yeah, I think somehow that somebody, however they were listening to a thing, they heard the echo of me talking. So taking care of those comorbid conditions will really, again, keep you in that, more likely to be in that group of people who get COVID. Still about 80% of people, but don't end up being hospitalized, don't have these really, really serious. Mm-hmm. That's one of those things that's totally within your power of doing.
Thank you. Okay. Can you hear me better if I talk through my mic? Okay.
Yes.
Perfect. I will do that. So another question that I had, more on the basics, was if you could maybe explain for folks, especially folks who aren't joining us presently on Zoom, but maybe listening in, if you could explain what flattening the curve means. What is the curve? What does it mean when we say flattening the curve? Why is this important? Um,
Yeah, that's a great question. It's kind of funny how these
Terminology.
right, and it gets thrown out there like we're all supposed to understand X, Y graphs, what we mean, what curve. There's a lot of curves we might care about, but not thinking about this.
Yes.
So when we think about, if you were to imagine, this image of how the numbers of cases are increasing each day, and I'll just take a minute to go back to what Chela was saying at the beginning, that yesterday there were 3,011 cases in LA. Well, today it's 3,000, it's over 3,500 cases. So there were 400 new cases diagnosed, yes. If anybody wants to follow this, you can look at ph.lacounty.gov, and they post it around 2 or 3 most days. They'll post the updates. So if you could sort of imagine those number of cases being put on a graph, and so you could see how those cases were increasing each day, the faster that graph increases, the higher the curve gets. And once it gets past a certain point, the healthcare system cannot meet that need. Part of why we had such a high mortality rate in places like Iran, China early on, Italy, was because the curve went so high, it went above the capacity of our healthcare system to manage. So any hospital has what they call surge capacity, in case there's a fire or a mass shooting, where they could all of a sudden, take in an unexpected or a larger than usual number of patients. But that surge capacity is only so big. Once we start to go over that surge capacity, that's where we really have very serious, where we're much more likely to see deaths, etc. So the goal is, I wish I did have a graph now. The goal is to keep the curve, instead of it being up here, where if you could imagine this is the capacity of our healthcare system, so that the cases stay under here. They might go longer, the number of cases that we have, but they're staying within the capacity of our healthcare system, this is my arm, to manage. If it goes way up here, the healthcare system is really, some people talk about it collapsing. I don't know if it's exactly that dire, but you're literally going to have a situation where they're like, do I put this person on a ventilator, or do I put this person on a ventilator?
Wow.
Because I go on, right? Do I give this person a bed? Do I give that person a bed? And so that's what everybody is trying to avoid.
It seems like that's what they're facing right now in New York.
Oh, shit, my battery about to die.
Yeah, I haven't read the reports the last couple of days with New York, but it seems like it's getting close to that, if not there already. New York seems to be, I don't know all the reasons, but New York seems to be a bit of an anomaly. They were saying that almost 1 in 3 people who are tested there for COVID turn out positive. For most other places, it's 1 in 10. So I think my guess, having been a little bit in New York, not much, but it's just the density of the population. I mean, that's, you're packed together on the subway, on the streets, even in apartments, narrow hallways, elevators, etc. So I just think it had much more opportunity to spread and affect many people. In Italy, I think we had different but maybe related dynamics, in that you had a lot of an older population. That part of Italy is one of the oldest populations in the world. You also have a lot of older people living with younger people. So they were more likely to probably get affected in that way by people who were maybe out and more mobile than some people.
So, Dr. Nina, what would determine whether they respirate you or not? What are they looking for? Numbers? What are they looking for exactly that would determine them to say, okay, she doesn't deserve, or doesn't need, or whatever the case may be, a respirator?
So I mean, of course, it only gets to that choice if they're out of them, right? Or if they're down to one for two people or two patients or three patients. Chances are they will base it on what other conditions somebody has, how serious their COVID currently is, how progressed it is, and what their age is. So they're literally going to be making some kind of decision, making this decision based on, do I think I can save this person? Am I more likely to be able to save this person versus this person? And those would be types of things that go into these equations.
Wow. So you could literally have two patients in the same condition and not have a respirator for both of them. I mean, how do you, at that point, it's like, how do you figure it out? Or
How
what
do
do
you
you,
determine which patient gets that
Yeah.
respirator?
Yeah, I have to say, these are one of these moments I'm glad I'm not a physician. But it is, I mean, when we really talk about why we want everybody to cooperate, why we need our politicians to be on board, why we need, there's some young people who don't get how serious this is, or there's some people who feel like the government's just trying to control their behavior, etc. We don't want anybody to have to make those decisions. And frankly, as people of color, I don't think we want to be in that. We don't necessarily want to have a healthcare provider looking at us and looking at somebody else who might not be a person of color and making that decision. Right? So, unfortunately, it is that serious. I think that a lot of the governors in the U.S. are really doing a good job of trying to push so that there are ventilators, so that there are, they're building hospitals and putting hospitals in cruise ships and doing all of this different stuff. But will it be enough? It's really hard to say. And in some places, it's pretty clear it's not going to be enough.
I have a quick question. Sorry. I know we have all of these numbers about like end of April, June or whatever. I mean, I know you don't know exactly.
Just gonna ask the same thing.
I want you to be 100% honest. When do you think that we, at least in California, will be? Who coughing? I'm joking.
No, I was laughing.
When do you think realistically that California will kind of reopen for people to go back to work and all of these good things?
When we gonna be able to get up out of here?
Exactly. That's what I'm trying to say. Because I'm struggling.
That's a really hard thing to bet. I think it could easily be 2 months.
Hold on.
okay, Dr. Nina, this is Tracy again. I have one more question. How true is it that for someone that might be HIV positive that is on their medication and undetectable, how true is it that they're not immune to the virus, but is it less, is it harder for that person to get the virus?
It's a little bit less about whether you're undetectable than what your actual T cell level is. So as I said, if it's above 350, then you're probably and it's not necessarily about whether you're going to get the virus. This is more of the concern about how serious a course you might have. I don't think we have any real evidence that certain people are more or less likely to get it. We know that certain people are more or less likely to either die or go to the ICU or be hospitalized if they get it. There was some hope. Now, part of your question, I think, is also about, Tracy, is also about the medications and HIV medication.
Right.
There was some hope, and I don't want to just say was, but there was some hope HIV medications might be effective in treating COVID. My understanding is at least the first medication in which that was assessed, it is not showing to work. Now, whether there are other medications, HIV medications, that might prevent COVID or might effectively treat COVID, probably more likely, I think remains to be seen. And I'm somewhat hopeful because there are, if you just look at the biology of the virus itself, there definitely are some similarities between COVID and HIV in terms of the way it takes over cells, the fact that it's an RNA virus. So, I mean, I have some hope in that, but we certainly have no data, be able to say one way or another.
Okay.
Dr. Nina, this is Valerie Spencer. Hi. Good afternoon to everybody, and congratulations to my baby sister Chela for actually hosting this. This is wonderful. So my question goes back to symptomology, and it's rather selfish. So I've been hiding out for 2 weeks. No one in, no one out. At what point can I have a decent night's sleep? And thinking, do I have this? Every cough, every sneeze, every nose tickle, every clearing my throat. And I'm sure I'm not alone in this. So can you just speak to sort of maybe incubation and contraction and all of those things? I think you get where I'm going.
Yes. So I'm not sure exactly why you were hiding out, but if for example, you were either exposed to somebody, say you were exposed to somebody, potentially exposed to somebody 2 weeks ago, you should not be worried about that exposure now. Because anybody who would have if you were going to get sick, you would have gotten sick within 2 weeks.
True.
And the fact that when you say nobody in or out, then you haven't done anything else to be exposed.
I have a follow-up question to that real quickly in terms of waiting inside the house to see whether or not you're going to develop symptoms. Is it that you have to reset the clock every time you do go out? Say I go out to get groceries or something. Do I then need to reset the clock and sort of wait another 21 or 2 weeks to 21 days or 2 weeks to see?
Yeah. So there's no recommendation that you have to quarantine yourself if you go out for groceries or go get Starbucks or something like that. It's that 2 weeks is more about if you traveled to somewhere where you could have been exposed, you had a friend you were around who was exposed, that any of those types of things would be when you need to do that. But, you know, I don't want to say but too much, but let me just add to that and say, obviously, if you go out, you've increased your risk somewhat, right? But if you do all those other things, the distancing, the washing your hands, the, taking care of surfaces, the way I see it is your risk is low enough, and we every day we live with some risk in our lives, and some feedback coming again. But the way I see it is every day we live with risk in our lives, and so I can't get too tied up in, in that. Like I said, I thought if we've done those things, we have to feed ourselves, right?
True.
We've done everything we can to protect ourselves in the process, and so I would say keep living your life.
Dr. Nine, I have a quick question. So say, hypothetically speaking, if you did get it or had it and what's the likelihood? Is it like the cold? Like I've heard different things, like you can't get it again in a while, so is that true, false, or it's somewhere in between?
It's another somewhat of an unknown. The thought is that most people will have immunity, not necessarily sure how long. It may be something like the flu where, the strain changes, and so over time you need a new flu vaccine.
Mm-hmm.
And they keep hedging that some people may not have immunity, and we really don't know yet how many people, what proportion of people will have it. I mean, what proportion of people will have enough of an antibody response to prevent it? That's the other testing that we really want right now. One is to test, does somebody have it and have more availability of that? But if we could get a lot of tests to say, okay, maybe I already had it, I've got antibodies now, I don't have to worry, that would be the other thing that would help us to get back to normal.
Okay.
I have two questions. One question is about the hot water. Do you have any knowledge about the drinking of the hot water that decreases the viral level?
Yeah, I mean, there's been these different myths. Really they're myths, so I'll just answer that quickly about if you drink water or if you gargle with vinegar or salt water, all of those things, you're going to prevent it. And there's really no evidence of that. And I think actually the drinking water is probably the one likely to even make any kind of sense. But drinking water is good for you as a general thing, whether it's hot or cold or room temperature,
Yeah.
but it's not going to prevent this.
Mhm.
Okay, and my other question is, can you recommend to us like some remedies or supplements or things that we can take that can keep our immune system up to par and active, so that if we come in contact with the virus, we're one of those people that can easily defeat it because we're up to par. We're ready to fight. Our body is ready to fight the virus.
It's another thing I can't, because it's another thing we don't have good evidence for. The one thing that I do, which has more kind of general evidence, is I take vitamin D regularly. There is some evidence that it helps prevent viral infections more generally, like somewhat reduces the likelihood of viral infections. Most Americans are deficient in vitamin D, and people of color are more likely to be deficient.
Background noise.
Who's muted?
Because people with
Thank
people
you.
with darker skin are more likely to be deficient in vitamin D, and so because our wonderful melanin, reduces the amount of UV light that's absorbed, that then helps get converted to vitamin D. So I think that's the main thing that I could recommend. Or we actually have concrete randomized trials that show evidence for viral infections in general.
Thank you.
Another question I had was, what sources can you recommend? What reliable sources or places for information around the developments surrounding COVID can you recommend, given that there are a lot of myths and theories and a lot of misinformation that's really getting spread easily in like our information age?
So the CDC website, has a lot of good information. They do have it targeted to different audiences. The local LA County website, I think, is also good, although I have to say, I feel like some of their information is really super detailed. And so if you're running a child care center, it's great, but if you're just trying to figure out what to do for yourself, maybe it's a little bit more than you want. Mm-hmm. I was looking at trans equality today. I think they have some very good resources. And if you're really just into the data and kind of seeing kind of what's going on in that sense, that Johns Hopkins website has a really nice page that really tracks it both in the US and in different places.
Thank you.
Is it true that it really doesn't, it has a hard time, it lives better in the cold and has a hard time living in the sun? Or is that BS?
Probably BS. I mean, some of the countries where, like, I think Iran, it's already pretty warm. And so that's like, it's wishful. I mean, it's a little bit of wishful thinking that's.
I was going to go back to Florida then because I thought that was the truth, but never mind.
No, and Louisiana is one of the places that's really getting hard hit now.
And it's hot.
I did want to mention one other thing for prevention is avoiding smoking. I realize just telling somebody if you're a smoker to just quit is not necessarily a realistic thing, but even reducing smoking, I would really consider if you smoke pot, use edibles instead. That smoking. There's a fair amount of evidence that any of those things that we take into our lungs are gonna make it more likely to have negative outcomes with COVID. Why are you laughing?
No, that makes sense.
You just killed that.
You just had to go and make it real.
You just shook us.
That's the only medication I take.
But what if we're smoking at home, but we've been in the house for like over 2 weeks, so there's nothing we could get if we're just smoking in our house, right? Make sense to me, please.
That's true. That's true. I mean, if you can manage to like stay in a bubble and smoke, I mean, I'm not necessarily worried about you. I think it's just, if you were to get it, you're more likely to have a negative outcome.
what happened when it runs out? That 2 weeks gonna run out.
Well,
He's got
good thing it comes
delivered.
with seeds. Good thing it comes with seeds sometimes.
Oh, you
I ain't got the
growing.
time to wait for all that.
No,
Bro,
she's saying that smoking just makes you susceptible to the
that makes,
virus. It
Mm.
makes you more open to the virus. You can smoke, but if you go out, you're considered compromised now because you're a smoker.
that makes sense.
Is that correct, doctor?
Yes, and that it, smoking attacks the, just to put it real simple, smoking attacks the lungs, COVID-19 attacks the lungs. So if you do get COVID-19, your lungs are going to be less likely to be able to fight it. Your lungs are going to be damaged already, so they're going to experience even more damage.
That makes sense.
Okay.
Can I ask
So you
a
mentioned,
question?
Black and mouths and stuff.
I'm never going outside.
well, you mentioned smoking. What about alcohol?
We gotta have something to do in this house now.
I hear you. I have not seen anything against drinking alcohol or any evidence that that's a problem.
Thank you.
I'm not encouraging people to I'm not, you know what I'm saying.
Yes. Cyrac?
I'm not going to add alcohol to your list of things to worry about. Let me put it that way.
Oh, thank goodness. Cyrac, you wanted to comment?
No, I want to ask a question to Dr. Nina.
Nina, Dr. Nina.
I'm sorry, Nina. I'm sorry. I just have a question. It's been bugging my mind. And I need an explanation. So India had COVID-19 on January 29. And India current status in the global count is very, very low. Why is that? I don't understand it. It baffles me. If the speed of the virus is the same speed as we have here in the United States, why is India not as bad as the United States? It has more people by population. It has no health. The resources are low. They're poor, and there's their caste system. So what is there in India that doesn't apply here?
Well, do they actually know how many people they have who are infected? I mean, we really are just learning how many people we really have in the US within the last,
Well, India right now, with the current globe count, India has 1,998 cases. New cases is plus 600. Total death is 58. New death is 23. Percentage-wise, by 1 million population is 0.04. That is India. And India has 1.9 billion people. So I don't understand why India has very low rate of COVID-19 cases compared to the United States. That doesn't make sense.
Right. I think there's a lot of places where that don't know how many cases that they have. And my guess, I actually have not paid much attention to India and all of this, but my guess is they have not tested many people, and so they really don't know. But let me just give an example. Let me just add to this in terms of Los Angeles. So our first case in Los Angeles was diagnosed on January 29th. And I was kind of vaguely, to be honest, I was sort of paying attention, but not paying close attention. But I would get these emails on a regular basis that said, we have 0 new cases today. And I got them all through February. So I was like, wow, we're doing great, right? It was March 4th was when the next case was identified. The next case, I think, was either 3 or 6, I can't remember. I went back recently and realized that in February, we tested 50 people in LA. 50 people were tested in Los Angeles. So we're getting these emails, or I'm getting these emails saying 0 new cases. It's actually meaningless because we actually had no idea how many people were.
Right.
Can I talk? So if we just do basic math, we don't need testing. We just need to use basic math. If India had the first case of COVID-19 in January 29, and that person was left untreated for 14 days with the assumption, the current assumption now, that 1 per COVID person infects 3 other people. If we do basic math, their population would have been dead by now. right?
Well, I'd like to lift up the good people of India in prayer. And I recognize that they're experiencing a great deal of trauma and stress as a result of the pandemic. However, if we may, there are so many people here in the United States where we do have some level of control that are experiencing trauma right here on this call, that if we might focus on perhaps what we have some onus over, instead of perhaps speculating about how the epidemic manifests itself in India, I think we might make, and this is not to say that that's not a good point or something that one should research, but that feels like a question for epidemiologists and scientists, and we're some trans folk and some other folk and some folk trying to make it through without, she said we can't smoke ourselves to death. She said we can't have a sip, we can possibly sip ourselves to death, but we can't smoke ourselves to death. We just found that out. So now we're just trying to make it through this thing so that we might be able to touch each other again.
Amen.
Yes.
Amen.
Yes, God.
This
Okay,
is Tracy.
hold
I
on,
have one more-
everyone. Just a moment. So there's a raise your hand function. So find it below you. Press that if you want to speak, please. So just for those that are listening on Facebook, just want to remind you, we have a dial-in number. That number is 669-900-6833. We will go on about another 10 minutes, so please get your questions in quickly. Thank you.
Chela, just quickly, the raise your hand, for those of you who are on the Zoom call, it's in your participants box. So if you click on the icon below your screen at the bottom that says participants and scroll over to your far right, you'll see the raise your hand feature.
Thank you, Queen Val.
Yes,
I
ma'am.
appreciate
Thank
it.
you.
And Tracy, the question is yours.
Yeah. Hi. I just wanted to know, do you know of a resource where one with an underlying health condition could be tested for COVID?
Somebody with symptoms or not?
Well, we think everything, I think, honey, I'm gonna speak for myself, everything is a symptom, honey. Runny nose, a sneeze, just like Valerie said before, I'm like, oh my God, I need to be tested.
Well, if it makes people feel better, or regardless, because I've got allergies, so I believe me, I got many symptoms I have to think about as well. Probably the thing you could worry about the least is a runny nose or sneezing. In terms of a symptom of COVID.
So it's more about the fever. Is it the fever more so?
The fever, the cough, shortness of breath, chest pains is another one I should have mentioned earlier. And then the more unusual one, but it's not maybe that common, is loss of taste and smell.
Yeah. Okay.
I am not. I think the advice is still, if you have that you're probably not going to get tested unless you have symptoms, and even if you have symptoms, you may not be able to get a test unless you're pretty serious.
Yeah, and that's what I don't understand, because they also say that it's a bunch of people without symptoms that have it. So it's like, what do they wait until they're at the respirator needed point to do anything, you know?
The problem is we still have a big shortage of tests. And right now, if somebody tested, if you or I tested positive and we're fine, there really wouldn't be anything different they would do medically.
That's in you,
And because we don't have enough. So like those two things, the fact that it doesn't change what you do as a medical provider, and the fact that we still don't have enough tests is why.
One more thing, I don't know if how.
Okay, Tracy, in the essence of time, hold that question, please. We'll come back to you. Thank you. Queen Vanessa?
Yes, ma'am. My question, Doctor, is if you have any information or anything that you can share as far as where we are in terms of developing a cure?
So there's a number of clinical trials that have started for a cure or treatment, but we are nowhere close to having one yet.
Okay.
Thank you. Are you finished, Queen Vanessa?
Yes, ma'am.
Okay, thank you. I see your hand, Latrice. I see your hand, Chris. I see Jaden on the line. I just want to check in. Jaden, did you have a question? I just want to try to pull in people who haven't spoke. Make sure that we're checking in with everyone. Okay. Latrice?
Yes, hi. Doctor, I was wondering, I've actually been, I had someone close to this was actually affected with coronavirus and actually in a coma as we speak now. So what's the deal with people when they do recover, if they do recover, and when they do recover, having to get on dialysis afterwards? What's that? Have you heard of that? And what does that mean? And why is that happening?
The main organ that COVID-19 affects is the lungs, but it also does affect the kidney. So for some people, they can have kidney damage related to that, and that's why some people are having to go on dialysis afterwards. Unfortunately, though, I don't know a whole lot about that, but that's the the reason why it have that impact on somebody. But I don't think it's true for most people that they end up on diet. It's not true for most people that they can't.
Okay, perfect. Thank you.
I'm sorry to hear about your loved one.
Yeah.
Thank you. And Chris?
Mine is going to be very quick. It was to the previous question. I'll send it to Chela because I'm not that, when I'm on this app thing, I'm not too sure how to use it, but I took a picture. There's a place that would give you tests. You have to call, regardless if you have papers, no papers. I took it outside of, I believe, APAIT. So I'll share it with Chela, and Chela can disperse it as she chooses. But there is a place that would test regardless. I don't know the details of it. I'm sorry.
Oh, but even if you don't have symptoms?
Well, that's what it said, but it could be lying, you know. I think normally they tell you call Department of Health. I had a few symptoms. I had a cough and some other stuff. I called Department of Health in Monterey Park. They told me to, stay home, keep checking my temperature. Don't come unless I'm pretty much about to die. And I mean, I understand that because they need to take care of other places. But for people who are afraid, if they do have a cough and don't have all the symptoms, the paper does say that they'll test. So I'm going to provide it to Chela. And I'll let her disperse that, as she pleases. And one more quick thing I wanted to say, it's just the one thing about COVID, I think we had to find a way, a light in the dark. Just simply today, I told a FedEx guy, stay safe. And he stopped and he gave me 4 pair of gloves and 2 masks. None that I have, I didn't have any of that. And so I think through all of the darkness, we have to find a light. We bring togetherness, and we're just finding a way to get through, because we're all affected, no matter what color, no matter how much money we have, regardless of what, we all are affected. So it just makes us one big family, and let's be there for one another. And that's all I wanted to say.
Thank you, King Chris. Let's see. Tracy?
Yeah, hi. This is my last question, I swear. I just wanted to know how, I see doctors that actually go on Facebook doing lives telling people that these items or these antibiotics will cure the virus. Why would these practicing doctors be doing stuff like that when we have, federal people and governments telling us different stuff?
It's a little hard to say, but I'm wondering, do we even know those people really are doctors who are doing that, or are they just saying that?
They are, in fact. I've heard doctors say azithromycin, colloidal silver.
Exactly. They say it's two medications to take together. Like this one particular doctor, he says take azithromycin and hydroglide something together.
Yeah. Well, so this is how I can tell you they're wrong without even doing any research. To do that kind of trial, to be able to actually identify an effective treatment, takes a pretty sophisticated approach to being able to identify people who are very sick, to randomize some to get the treatment, some to get nothing or to get a placebo, and then follow them over time to actually see what's effective. That's really the only way you can come to that conclusion that this works, this drug works. And nobody's done that yet, and nobody's done it effectively yet. Otherwise, we would be seeing. I mean, those drugs that you're talking about are widely available drugs, and if it worked, people would be using them. But we haven't had the time to do that. The Chinese doctors haven't been able to do that, and they have actually a very good medical system. So it just doesn't make any sense. But there are unethical doctors out there, just like there's unethical all kinds of other people.
Right.
So, Dr.
Hold on, please. There is a speaking order. There's Deanna, and then Amaya, and then Valerie.
Okay, I just really wanted to thank the doctor for coming to engage with us on a personal level, and I wanted to ask her practice.
My practice?
As a doctor.
Oh, so I did an introduction at the beginning. You probably haven't joined yet. So my training is in epidemiology. I basically study epidemics, but I have a PhD, not an MD, so I don't treat patients.
Oh, got it. Okay.
Thank you. Queen Amaya, and then Valerie.
No, the volume. Can you hear me now?
Yes.
Yes. Oh, perfect. Good afternoon, y'all. I work for a VSN facility. I'm a manager where I facilitate 13 members who are post-incarcerated and in transition and also suffer from mental illness. Currently, we have 2 people in isolation, and a lot of the members were really, really worried about whether they should have masks on because they access everything. Like, there's only 2 bathrooms for the members, and they have to occupy, each at one time or whatever. What could I do as a manager to facilitate safety, but also so they're not worried, just put their minds at ease, so to speak?
So that's a great question. The basic things that we recommend, the distancing, the soap, all those things are still going to be the most important, regardless of those other things like potentially personal protective equipment, etc. So I just want to ask first, do they have enough access to those types of things? Soap, hand sanitizer, bleach for cleaning surfaces. Are you able to have that sufficiently first?
Yes, we have possibly every tool. They just gave all the employees N95 masks, and we have gloves, but we don't have enough gloves to facilitate all the members, just the staff. And because of the shortage in the stores and all of that stuff, it's just really hard to be able to make sure everybody has what they need as far as gloves and stuff like that. But we always enforce people to wash their hands often. But because we're dealing with a population of people with mental illness, they don't necessarily, I don't think they're really taking the epidemic as seriously. And then there are some that does take the epidemic very seriously, but more in a more fanatical way in their mental state of mind. So it's just really hard to accommodate them. And I don't want to, it's really stressful. It's a high stress environment and sometimes pretty hostile. Thank God, being a leader in the community, they kind of respect me a little bit more, but a lot of other employees and colleagues who are not LGBTQ, gender non-conforming, gender non-binary, has kind of quit or took a leave of absence for 2 weeks. So it leaves just me and maybe a handful of others having to facilitate a household of 13 members.
Wow. So it's stressful for them, but it's also very stressful for you. And I want to acknowledge the work that you're doing. So I don't think people need, I'll just say first, I think people don't need gloves. It doesn't go into our skin, into our bodies. It can go through mucous membranes, that's a concern, or in being inhaled. Where they might need gloves is for cleaning, so they don't get the cleaning products to touch them or cause problems that way, but they don't otherwise need gloves. And gloves, unless you're really wearing them properly, again, they can, even more so than masks, I think gloves can be really problematic because you touch all kinds of stuff and then you touch your face or you don't take them off properly, all that kind of stuff. So I wouldn't even go there with the gloves. The hand washing is much more important. We talked a little bit earlier about masks, and this is, I have to tell you, it's a trickier one, and guidelines are changing about it. So far they've been saying to the general public, you don't need masks, or don't worry about masks. They may be shifting that, and there's some experts who say they probably do offer some protection. IREC, who was on earlier, had a connection for masks. More and more people are making them by hand, and even the hand, the ones made by hand will offer some basic protection. So the question, I think your question is, how do you get them? And I feel like there was both IREC and there were maybe some other people on the call who thought that they had some connections for being able to get them. Do I feel like they're absolutely necessary? I have to say it's a little bit tricky. I would have, if I had to live all day with a mask on, I probably wouldn't, unless I was sick and I was afraid of, if I was sick and I didn't want to affect obviously didn't want to affect my kids or my husband, I might. But I couldn't imagine being, wearing a mask all my waking hours, in that kind of a situation. And so I'm sorry, it's not as definitive of an answer as one might like, but literally the guidance around this is changing as we speak. And if you can get handmade mask, it may offer some people some peace of mind, but they would still need to know how to use those properly as well. Is that helpful at all?
Thank you, ma'am. Thank you very much.
Thank you. And now back to Queen Valerie. And I see your hand, Chris. Thank you.
Yeah, I just kind of wanted to piggyback on Dr. Nina in answering Tracy's question, particularly because we're both from the old school. And one of the things that we encountered in the early days of the HIV epidemic were various local doctors who were using, let's call them various formulas in their practice, and got what they call, quote, good results. And so I just want to lift up that there's a difference between anecdotal data and peer-reviewed, scientific, quantifiable results. So what you all might have been hearing are some doctors who share a point of view that there's a couple of prescriptions, a couple of formulations that they have had a good result with. But the challenge in making that a public health message, meaning they should not have done that, is that people might be allergic to some of those compounds. People may have various reactions to some of those compounds. And most importantly, especially when you deal with people of color who are marginalized and distrusting of medical systems, people may get those compounds through whatever means, self-prescribe, and forego the medical care system altogether, making that a very dangerous public health message. So let's stick with what we know for sure, perhaps, before we start playing like, kitchen scientists and it goes really wrong.
Thank you, Queen.
One last thing about the Surgeon General's update this morning basically was, whenever you leave your house, wear a mask. It may not protect you from contracting the virus, but since we know that several people have the virus and are asymptomatic, wearing that mask when you go out might protect others around you, even in your casual space, from being infected with the virus that you don't know you have. But I must say, if you have an N95 mask, they are very uncomfortable. and
They
hard
sure
to
are.
breathe in. They are hot. They are hard to breathe in. So we want to be mindful of touching our face when we wear those apparatus around our face, because that's the main mode of transitioning, etching that thing around your face and adjusting it. And then, like Dr. Herrera said, you contract it through one of the portholes. Thank you, Chela.
Thank you. Thank you, everyone. I just want to check in with everyone real quick. Oh, Chris, you had your hand up. Sorry. Go for it.
Mine was quick. They had something that they said that actually cloth gloves or gloves that shit. Oh, excuse me. Sorry, y'all. What do you call it when it takes it in? Dissolve.
Porous? You're talking about porous?
Hand sanitizer.
So, it says that if those gloves are actually better, because I know you said we don't really need to use gloves in the first place. But did you hear about that, or is that like true, false? But they said that cloth, because latex, if you sneeze or someone sneezes, it can last on it longer than what those cloth gloves or those gloves that will absorb. And sorry for using the S word, y'all.
I guess I'm trying to figure out though, how is that helpful? Yeah, I'm not sure why it would be helpful, because it's possible, I don't know, if you touch something that has a virus and it's wet, then it still soaks down to your fingers. You touch your face with the gloves. I don't know. I'm not seeing how it works. I haven't read that anywhere, but and it's not going to help you protect you from a cleaning product, right? That might be hazardous.
Not going to clean it. I guess where that is that case, if someone sneezes, or even if you're sick and you have it in, I have a few of them. They absorb very, very thick, and so you don't even feel it. It doesn't come to your hand. And so, say for instance, I was to touch something, it lives longer on latex than those gloves that absorb. Again, it was on the news and something else. I try not to really pay attention to as much as I can for my mental health, but that was something that came out, and I just wanted to ask, did that make any sense to you?
It doesn't, but I guess I have to do some reading on that one.
Okay.
There was a question from Jaden Fields in the chat. Can I address that? So he was asking about the antibodies from those who recovered being used for other folks who become infected. I think they're looking to test that to see if that will work. I think that's one of the things that they're planning, or he's planning to try. I don't know if they've actually started the trials, but my understanding is they are actually already collecting plasma from people who've recovered from COVID-19.
Yeah, NBA player got one of those NBA players that had it. He donated plasma today to try to help with that.
Oh, that's amazing. Thank you. Queen Vanessa, just want to check in with you real quick. Do you have anything you'd like to share?
No, I just wanted to say that I think it's an amazing idea that we all came together to have this conversation. I wanted to express my gratitude and thanks to Dr. Harawa for joining us and answering questions and just being here in community space to enable us to have dialogue with one another and answer some of these questions.
Thank you. Also, thank you, Dr. Nina, for your time. And I want to thank everyone who participated, came through. Thank you for joining us today. And remember, here at the Tribe Chat, you are us and we are you. Something magical always happens when you check in with your tribe. So we'd like to invite you to join us again for our regularly scheduled time, which is Tuesdays, 7 p.m. Pacific Standard Time. And again, thank you everyone for dropping in. We'll see you next time.
And I hope people will take this as an opportunity to share good information as well with other folks, because there's lots of people in the community who are overwhelmed with information.
Absolutely. And this session was recorded. Is it over, Chela? And I will actually make it available. I will send out a link and I will post it on my Facebook page, Instagram, and if you want it sent to you directly, I can be reached at Chela, Chela, at theuwc.org. Everyone okay? James, you okay? Gia?
Mask. Can I say about the free mask?
Oh, and Sarak, I did send you an email with our org's address and phone number. So if you'd like to send those face masks, we will definitely help give them out.
What email address is it? Because I didn't get it.
It is your Gmail address?
Is it Chela? Chela?
Yes.
All right, got it. So whoever is on this chat, if you need masks, please email me, text me, or go to my Facebook wall. It's free. We ship it to you directly. Okay, thank you.
Thank you. Have a good one, everyone. Bye-bye.
Shayla?
Yes. Okay, wait. Hold on.
Huh?
Hold on. Okay. Yes. Okay. Yeah, that's it. We'll do a
Are we on live?
We'll do a post chat. No, yes, we are on live, so watch your mouth.
It's all good.
You know, my sis, she goes in real quick, like Sunday church. Okay, we have stopped streaming. Hi, Billy. And hold on, let me stop the recording.